Texas Medicaid, which is now about 4 million people on any given day, almost everybody in our program now is enrolled in a risk-based HMO. And so one of the real challenges for everyone in the advocacy world who has a constituency that may be using Medicaid, we've all got to learn a lot about the Texas Medicaid Managed Care contract and what's really happening on the ground in those plans. What are the strengths, what are the weaknesses, or else you can't really advocate effectively for your constituency. So there's a lot there. I have been fortunate enough over the last few years, before the passage of the ACA and since, there's been a little bit more philanthropic interest in some of the healthcare work and in ACA implementation. So we've been able to add a few more staff, and we've had folks here working sort of the consumer perspective in the private marketplace, the commercial marketplace for insurance in general, as well as the specific subset that's the ACA Marketplace. Because Texas hasn't done a Medicaid expansion, we have even poorer people in the marketplace than you would normally, because we've got those folks between 100 and 138% of poverty who, if they were next door in New Mexico or Arkansas or Louisiana, would be getting Medicaid. But here, they can go to the marketplace and get coverage. And in fact, all of our legal immigrants can get coverage in the marketplace all the way down to zero income, because they've been excluded by the Texas legislature from Medicaid. One of only 6 states that does that. So we've got people with really low incomes in the marketplace, which is something of a work in progress, the marketplace itself, right, in terms of its affordability, and definitely, wasn't really designed to provide coverage to people with incomes at 50% of the poverty level or such, who in theory are in there in Texas. So we've got a lot of challenges for low-income Texans in the private marketplace.